Hi class, today we are going to talk about chapter 4, the integumentary system, which is the largest organ in your body. The skin is the largest organ in your body, and most people don't think about the skin as an organ. However, it is. It's made up of multiple different tissue types that work together to act for a specific function or group of functions. The integumentary system is composed of the skin as well as the glands, so exocrine glands, not endocrine glands, but exocrine glands, hair, and nails. The term integument means to cover or a covering. So the integument is covering the outside of the body. And though the term integumentary is only used as a collective term for the or a collective name for the system, there are many different combining forms, prefixes, and suffixes that we're going to learn for all of the structures to be described accurately. This integumentary system has multiple functions. The first and largest function is protective in nature. It is our first line of defense against microorganisms. So when you have a cut, that's when bacteria or viruses can get in through your skin and infect your body. So when it's unbroken, works as a protective mechanism and an immune defense system. It also protects us against water loss. If you didn't have skin, you would lose a ton of water through insensible perspiration. And it protects us from damaging ultraviolet light radiation. It also functions in temperature regulation through the sweat glands and in synthesis of vitamin D, which is required for putting the calcium into your bones. It also helps with your mood, which is why everybody in Vermont is vitamin D deficient in the winter because we don't have enough sun. And so the sun on your skin is what creates the synthesis of vitamin D. The skin is organized into multiple layers. The epidermis is the outermost layer. Then the dermis is underneath the epidermis. And the hypodermis, which is also called the subcutaneous layer, is the deepest layer. Combining forms for the skin include dermo, dermato, and cutaneo. And as you see in blue here, the dermis and the epidermis combined are called the cutaneous membrane. So that's where cutaneo comes from. There's a lot happening in this picture, but this is a picture of the structure of the layers of the skin. So you can see here we have the epidermis, this sort of thick layer here, which is made up of multiple different layers of cells, 4 layers in thin skin and 5 layers in the thick skin on the palms of your hands and the soles of your feet. Then we have the dermis, which is this nice thick layer here that's mostly a connective tissue. It's got sweat glands. The hair, you can see, begins to grow in the dermis and then pierces through the epidermis to come outside of the body. Oil glands that are here that secrete oil onto the hair. And then there are lots of blood vessels and nerves within the dermis. And then the hypodermis or subcutaneous tissue is mostly fatty tissue with some larger blood vessels and nerves that are going to be supplying the smaller blood vessels and nerves in the dermis. The dermis is also the home for many of our sensory nerve endings, and there are multiple different kinds of those that I will not go into in this class, but take my anatomy class if you want to learn more about that. We have multiple structures in the epidermis. Keratin is a protein that is within the cells of the epidermis. So when I said there are 4 or 5 layers of the epidermis, those cells are called keratinocytes or keratinocytes because they are made up of this protein that becomes densely packed and dry on the surface of the skin, which is what allows us to have dry skin. Melanin is a pigment that is formed by melanocytes within the epidermis, and that is what gives our skin its color. Hair begins in the dermis and comes through the epidermis, and so the combining form for keratin is kerato, and the combining form for hair is tricho. The nails also begin in the dermis and pierce through the epidermis, and combining forms for nails are onycho or unguo, and sebaceous glands, which are our oil-producing glands, are sebo for the combining form. And then our sweat glands, which are also called sudoriferous glands, the combining form is hydro. In the dermis, like we saw in the picture, we've got blood vessels, nerve endings, hair follicles, sebaceous glands, which are sebo for your combining form, and sudoriferous glands, or hydro, for your combining form. We also have multiple combining forms that indicate colors. So I'll give you a second to look at this and decide what you think. You might want to just pause right now to figure out if you can determine these or remember them from your reading. And now that you've unpaused because you know all the answers, the term for redness is erythro. Yellow is xantho, which is spelled XANTH/O. For black, it's melano. White is leuco, and blue is cyano, like cyanosis, when you have bluing of the lips and the nail beds, as you can see here. Some prefixes that we'll see in this chapter are hyper and hypo, which we've seen previously, meaning excessive or not enough. Intra, which means within, and per, which means through, and then sub, which means under. So the subcutaneous layer is under the cutaneous membrane, which is made up of the epidermis and the dermis. These suffixes we've also seen before. Ectomy is the removal of. Itis means inflammation. Osis is a condition of. So xanthosis would be a condition of yellow or yellowed skin. Plasty is a surgical procedure too. And rhea means flow. Take a minute and look at this slide, maybe pause me, and see if you can figure out, just from knowing the suffixes and the combining forms, what these terms mean. So dermatitis, we have itis, meaning inflammation, derma, meaning skin, so inflammation of the skin. Keratosis, osis, is a condition of. Kerato is the keratin or the dry protein. So this is actually a skin condition where there are dry patches of skin. Onychomycosis is how you pronounce that word. Mycosis is a fungal infection. Onycho is of the nail. So this is a fungal infection of the nail. Paronychia is a infection around the nail, so sort of like around the nail bed. And xanthoma is a fatty yellow lesion under the skin. So it's where little fat deposits sort of happen underneath your skin and you get this yellow plaquing. So oma is a tumor, xantho is yellow. So, and notice here the O from xantho has been dropped. We don't need the combining vowel because the suffix begins with an O. And here it's paraonychia, so the A has been dropped from para. So para being around the nail. Here's some more practice for you. So I would pause it on this slide, see if you can figure out what these terms are, and I will have the answers for you on the next slide. All right, so the combining form for skin is derma or derm, and the combining form for each of these colors is individualized, right? So we have leukoderma for white skin, erythroderma for red skin, and xanthoderma for yellow skin. Here are some diseases and disorders that are not built from word parts, so we can't necessarily determine their meaning by breaking the words down. Cellulitis seems like it should be built from word parts. It is inflammation of the cells, but it is not truly built from word parts. A fissure is a crack in the skin. A keloid is a scar that heals with excess scar tissue. So they're typically raised off of the rest of the skin and they can be like smooth and shiny in texture. Squamous cell carcinoma is a cancer of the squamous cells. And urticaria is the medical term for hives. There are multiple different bacterial skin infections that can happen. A carbuncle is a cluster of boils, which are pus-filled lumps in the skin. If we skip down here, a furuncle is a singular boil. So a furuncle is a boil and a carbuncle is a cluster of boils. Cellulitis is inflammation of the skin, which is due to a bacterial infection. That is a generalized term. It doesn't indicate what bacteria might have infected the skin. Impetigo is a bacterial skin infection as well. MRSA is, so this is an abbreviation, MRSA, but we pronounce it as one word. And you'll see that going through these chapters, there are multiple abbreviations that get pronounced as a word, which is more of an acronym. So MRSA is methicillin-resistant Staphylococcus aureus, which basically is a staph infection that is resistant to antibiotics. It's a nasty infection that's very hard to clear from the system, and it's very contagious. And then paronychia is infection of the skin around the nails. Common fungal infections, candidiasis is the term for a yeast infection. Tinea is the medical term for ringworm, which is a contagious fungal infection of the skin, hair, or nails. And then trichomycosis is actually a bacterial infection, though mycosis indicates that it's fungal. It is named inappropriately, so it should be called trichobacteriosis, but they haven't quite changed that name yet. We also have a couple of parasitic infections, which is gross. So parasites can infect us just as well as bacteria, viruses, and fungi. So scabies is like microscopic mites that burrow into the skin and lay the eggs, and it is extremely itchy. And pediculosis is the medical term for lice, which is also extremely itchy and makes me scratch just talking about it. And the last thing that can infect us are viruses. So some common viral skin infections are a fever blister, which is the herpes simplex virus. This will give you like cold sores. And then shingles, which is herpes zoster, is part of the chickenpox virus that goes, if you've had chickenpox, the virus will lay dormant in your nervous system, and then it can flare when you're older and your immune system is weakened and create a vesicular rash along a nerve, like all of the endings of the nerve where it was sitting dormant. Shingles is extremely painful, and it is something that you definitely don't want to get. These days, most kids are getting vaccinated against chickenpox, which they believe will also keep you from getting shingles. Medical terminology is constantly being updated. So some terms that we used when I was in school 20 years ago are no longer in use. And one of them is this decubitus ulcer, which is an ulceration of the skin that occurs from lying down. So decubitus means to lie down. It became called a pressure ulcer and now also a pressure injury. So basically you don't have to be lying down to get one of these, but these occur when people are immobile and they're not rotated often enough and they're having too much pressure on the skin and you get breakdown of the skin. Some of these can be very, very deep and very bad and hard to manage once they occur in a person who does not have the ability to move. Here we've got some surgical terms that are built from word parts. So take a look at these and see if you can figure out what they mean based on the parts that you know. So dermatoplasty, plasty is surgical procedure to, dermato is the skin. So dermatoplasty is a surgical procedure to the skin. Rididectomy is ectomy is the removal of. Retido is wrinkles. So rididectomy is the removal of wrinkles. So this is the medical term for a facelift. That's sort of the common terminology, is a facelift. Here we've got our surgical terms not built from word parts, so we're going to have to memorize these. Cauterization is the destruction of tissue using heat or extreme heat. Cryosurgery is the destruction of tissue using ice cold. Excision is the removal of something. Mohs surgery is a specific type of surgery that's used with skin cancer, where they take slices of the tissue and look at them under a microscope immediately, and they keep doing that until there's no more cancer cells that are visible on the microscope. And then a skin graft is where they take a section of skin from one part of the body and sort of transplant it onto another part of the body where they need healthy skin to grow. Some complementary terms built from word parts. Examples, erythroderma, we saw that earlier. It is a condition of reddening of the skin. Hypodermic means beneath the dermis. Percutaneous, per means through. Cutaneous is the cutaneous membrane or the skin, so this means through the skin. Subungual means below the nail. And xerosis, so osis is a condition of, and xero means dryness. So this is a condition of dry skin. Complementary terms not built from word parts. An abscess is an infection underneath the skin, so typically a bacterial infection that is walled off and full of pus. Diaphoresis means sweating. A macule is a flattened lesion on the skin, and a papule is an elevated lesion on the skin. And then a vesicle is like a hive. It's a watery, fluid-filled sort of bubble on the skin. There are multiple things on the skin that can look like bruises and that can be caused by blood leaving a blood vessel and pooling underneath the skin, and they're named depending on their size. So the smallest, which is 0.5 centimeters or under, is called a petechia or petechial hemorrhaging. Purpura is the middle size, so 0.5 centimeters to 1 centimeter. And then if the spots or lesions are between 1 and 2 centimeters, we then call them ecchymosis. Ecchymosis can be used to describe a common bruise, which is, like I said, that blood underneath the tissues, but it's not always the result of trauma. So this can happen for other underlying causes. So it's important that we get a good solid patient history before we decide what these different spots on them might be from. Some abbreviations you're going to see this chapter include FTSG, which is a full thickness skin graft. IND, which means incision and drainage. So we might do that as a procedure with an abscess. SLE stands for systemic lupus erythematosus, which is commonly referred to as lupus, which is an autoimmune disorder that shows up with skin lesions. And TD is transdermal. There are many medications that can be introduced to a patient through the skin, and depending on how they are introduced and where they are delivered, we have different names for these routes. So subcutaneous is in the hypodermis, or the subcutaneous layer of the skin. So that's an injection. Intramuscular is an injection through the skin into the muscle. This isn't on the list, but intradermal is an injection of fluid into the dermis itself. So a TB or tuberculosis test is an intradermal injection. Intravenous would be through the skin into a vein. And then transdermal is through the skin. So oftentimes with transdermal, it's like a patch. Like some people have hormone patches, or you might wear a nicotine patch to try to stop smoking. So that's a transdermal, where you are absorbing through the skin. Sometimes we can get confused when there are multiple terms for the same thing, like subcutaneous layer and the hypodermic layer of the skin are interchangeable terms. But when we're using these terms medically, a subcutaneous injection is to administer drugs into the subcutaneous layer, and you use a hypodermic needle in order to do that. So hypodermic is used to describe the needle, while subcutaneous is used to describe the location or the injection. So yes, the location of the injection. So to memorize that, hypodermic explains how, they both start with H. Subcutaneous shows you where. This is getting a little nitpicky, but for those of you who really like to know where words come from and why we use the words that we use, Latin terms are generally used to describe structures of the body. So cutaneo is a Latin origin. So the term subcutaneous points to the subcutaneous tissue, which is found underneath the dermis. Greek terms or word parts are generally used to describe diseases, conditions, or treatments. And the injection of a hypodermic needle or subcutaneous injection is a treatment for many things. And so hypodermic describes the needle, which is the tool used in the treatment. You can see here that this injection is occurring at a 45-degree angle, piercing through the epidermis and the dermis and landing in that subcutaneous tissue. If we were doing an intramuscular injection, that would happen at a 90-degree angle, and an intradermal injection happens at a 10 to 15-degree angle. Similarly, transdermal and percutaneous are similar terms that both mean through the skin, but transdermal is most often used as the root, meaning it's going through the skin, and this is typically when we're thinking about medications that are going to absorb through the skin, whereas percutaneous means through in the use of a needle. So it usually, when we use the term percutaneous, we're usually talking about a needle. So we are going through the skin with a needle. Medical terms can be used as a noun, or they can be used as an adjective. Not all of them, but many of them. So if they're describing what's happening with the patient, you could say the patient has erythema of the cutaneous membrane, or you could say the patient's cutaneous membrane is erythemic. Similarly, seborrhea could be seborrheic. Diaphoresis, which means sweating, could be diaphoretic. If your patient is diaphoretic, then they are sweating. So that's the end of our lecture for the integumentary system. I will see you back next time. And I don't know what system we're doing, so it'll be a surprise for all. Have a great day.